Hello, everyone. Thank you all so much for joining. Happy Wednesday. My name is Danielle Edwards. For those of you who don't know who I am, I'm Jet Foundation's Community Engagement Manager and host a lot of our educational workshops and webinar series this year. We're so excited to have Dr. Panda with us today, who's a pediatric neurologist from Arkansas Children's Hospital that will be speaking about updates on COVID-19 and Duchenne muscular dystrophy patients. For any questions you may have, please feel free to just drop them in the chat section below and we'll answer them after the presentation is complete. We're just going to wait a few minutes and let some other folks sign on. I know we have a good turnout today, so just give it a few more moments. For all those who are just joining, thank you so much for joining Jet Foundation's virtual workshop series. My name is Danielle Edwards. I'm Jet Foundation's Community Engagement Manager. We're so excited to have Dr. Panda with us here today, who is a pediatric neurologist at Arkansas Children's Hospital, that will be speaking about updates on COVID-19 and Duchenne muscular dystrophy patients. For any questions any of you may have for Dr. Panda, please just drop them in the chat section below and we will answer some questions after the presentation is complete. With that being said, Dr. Panda, I will toss over the screen to you and we can start this webinar.
Sure, thank you.
All right, yep.
All right, so which screen are you guys seeing? All right, can you see my screen okay?
Yep, we can see it.
Okay, sorry, thanks. Thanks guys for the opportunity. And thanks for the families who have taken the time to join
All
this.
right, that looks good to me.
So this is my real name. It's Vera Pandian, but I go by Panda. I'm a child neurologist at Arkansas Children's Hospital. I just want to briefly talk about the COVID-19 and impact of COVID-19 on Duchenne muscular dystrophy patients and their care. These are my disclosures.
Dr. Panda, we can't hear you.
Oh, can you hear me okay?
I'm able to hear you.
Okay.
Okay, no, never mind. I just can't. You're good.
Okay, sorry. All right, so before we jump into the impacts of COVID-19 or Duchenne, let's just briefly talk about the COVID-19. We all know about this, we heard about it, and we're actually tired of hearing about it now, right? So it's coronavirus disease 19, which is caused by the virus called SARS, which is severe acute respiratory syndrome, coronavirus 2. And the disease that the virus caused is called the coronavirus disease 2019, and so it's called COVID-19. And we know about the symptoms. It's like other flu-like symptoms: fever, cough, shortness of breath, sore throat, headache, reduced taste sensation, reduced smell, etc. And there are also severe manifestations of leading them into hospitals, causing pneumonia, and then what we call acute respiratory distress syndrome. And we think it's more common in older population and also those individuals with some medical problems, but that's not actually true. We're also seeing severe manifestations of this disease in otherwise healthy individuals. And as far as children, it's actually majority of these hospitalized children with COVID-19, they had one or more underlying medical problems, like they have a chronic breathing issue like asthma or chronic lung disease, some sort of heart problem, and also if they're immunosuppressed. And of course, as we all know, the management is supportive, meaning there is no specific treatment available as of yet. The key thing is social distancing, and that social distancing, which is critical to limit the spread, has caused a lot of reorganization of the healthcare practice and the way that we treat patients, the way they see patients, the way they get care. It has reorganized. So though there were, we were able to provide some sort of emergent and urgent care in the hospitals and office settings, a lot of the elective procedures, elective testing, and elective clinic visits were being canceled or rescheduled. Now, touching on the impact of COVID-19 on DMD care. So what do we know about it, and what have you learned so far from this experience? We do know patients with Duchenne muscular dystrophy or maybe at increased risk of developing severe manifestations or severe complications of COVID-19. The reason being several factors. One, these kids are on steroids, which can be an immunosuppressant, and they are on steroids for a long time. Then, some of these kids would have breathing issues, what we call respiratory insufficiency, needing to use long-term ventilation support, cough assist, and things like that. And we do know Duchenne kids would have some heart issues. So all of these would make them at increased risk of having severe disease with COVID-19. Now, the good news, as far as from my experience, I haven't had any of my patients who were either tested positive for COVID-19 or who were hospitalized because of COVID-19. I think that speaks to the persistence of our Duchenne community in terms of taking care of their kids and socially isolate themselves. And I think that's actually kudos to our families. Now, what are the general recommendations for our families? Now, obviously, we all should follow what's the current national, state, and local guidelines in terms of social distancing, wearing masks, etc. And we should also follow the recommendations for people at risk for serious illness from COVID-19. These recommendations are evolving and changing based on the new information that we learn. So it's important for us to keep up to date on this and follow these recommendations. And the key is obviously patients and family members should vigilantly practice social distancing, which include avoiding public gatherings, public transportation, limiting time in stores, using masks all the time, using remote technology platforms in place of in-person meetings or activities, like Zoom meetings if you want to talk to someone, if you want to meet with someone. telehealth if needed. So these are the general recommendations. Now we're going to jump into a little more specifics. So multidisciplinary care. So what do we mean by multidisciplinary care? A lot of patients who come to Arkansas Children's would know, and I think many other places would know, when you go to a clinic visit, you would get all the tests done and also see multiple providers, multiple specialists, your neurologist, your heart specialist, your lung specialist, the physical therapist, all in one day. So how is that impacted during this COVID-19 pandemic? Now, like we talked about, you see all of these multiple providers, and it is critical to have a comprehensive multidisciplinary care for these patients. Now, and we do a lot of assessments periodically when you come every 6 months or once a year. We do, the echocardiogram, which is ultrasound of your heart. We do the pulmonary function test, your breathing test, checking X-rays, bone density exams, and also we do some blood work to monitor side effects from steroids and other medications. How are these affected? There is a tremendous burden on healthcare systems, resulting in either interruption or discontinuation of these elective and non-emergent services and procedures. How can we modify these, or what is our recommendation, or what should we follow during this time? Would be, of course, to enhance the safety of our patients, of our families, and also the medical staff. I think the standard practices can be modified and individualized. We don't have to go by books during these times, and these should be modified and individualized. Sometimes, people can do home blood draws. There are home sleep studies if we have to do, if clinically appropriate. These should be considered to minimize the exposure and risk. Now, if we really have to do testing in person, that could affect the management, that could affect the way that you treat these children. I think those tests can be safely performed with appropriate precautions and the personal protective equipments. And one of the key things is the pulmonary function test. Well, I'll talk about that in a minute. Now, when I say the standard practices can be modified and individualized, that should also imply if we do not need some sort of labs to be done that we usually do every 6 months or every year, those can be delayed. Those lab tests can be delayed. The other key thing is continuation of this comprehensive care using telemedicine or telephone visits. I know telemedicine has both positives and negatives, but we should continue this comprehensive care. We have done that here in Arkansas Children's. I know a lot of other places are doing it. They did that. You could do multidisciplinary telemedicine, meaning all of the providers, at least few of them, can join at one time, or you could do individual providers because it's telemedicine. They could call in the same day, they could call in a different day. And I think we should continue with this comprehensive care using alternative options. Now, what about the treatments? So when we talk about DMD treatments, the first thing, of course, that comes to our mind is the steroids, the corticosteroids. We do know these kids are on steroids. Most of them are on steroids for a long time, and it could be an immunosuppressant, like we talked about. Now, the key thing is we have to continue the current corticosteroid treatment while they are on, no matter if it's prednisone, prednisolone, Plaza. I think that should be continued. Like I said, we should not discontinue or adjust the dose without discussing with your neurologist or neuromuscular or any whatever specialty provider. Some places can rehab physicians manage that. So I think you should not change or stop the steroids without discussing with your doctor. Of course, renew prescription medications in advance and make sure you have enough supply at home to minimize the need for going to pharmacy or going out. Now, stress dosing. We all talk about this stress dosing. Stress dosing means a higher dose why do we need this? When do we need this? I'm not going to go into details because that's something that we all know. Now, if the steroids are stopped suddenly, or if we missed, either by accident, or if the kid is vomiting because of some sort of illness, some sort of problem, vomiting more than 24 hours, could not keep the medicine down, or if your body is under extreme stress, like severe illness, surgery, or trauma, anything like that. In these situations, we need higher dose. The body needs higher doses of steroids, what we call stress dosing, because to prevent what we call adrenal crisis. Adrenal crisis is an emergency. It can make you have headaches, seizures, and it's an emergency. You need to go to the hospital for that. So to prevent that, in these situations, we need to have stress dosing. And I encourage each and every one of the parents to know about this and also advocate to the physicians when you go about this. If the kids get sick or hospitalized for something from COVID-19 or anything, make sure you call the neurology or endocrinologist and let them know. And always know about this, like I said, know about the higher doses of steroids, know about stress dosing. Maybe consider having something at home. There are intramuscular injections that could be given at home in cases of crisis if you need to use that. So consider those options. Discuss this with your neurologist and endocrinologist. Like I said, intramuscular injection of steroids may be necessary if unable to take steroids orally. Now, moving on to another set of treatment that we are currently using, what we call the exon skipping agents. And this doesn't apply for all of our Duchenne kids, but very few of them who have specific genetic mutation that would make them qualify for these medications. So currently we have two FDA-approved exon skipping agents in the US, which is the eteplirsen or Exondys and the golodirsen or Vyondys. So Exondys is for patients who have mutations that is amenable to exon 51 skipping. Golodirsen is for patients who's amenable to who have mutations that is amenable to exon 53 skipping. I also included viltolarsen, which is also an exon 53 skipping agent. It's not FDA approved in the United States, but it is approved to use in Japan. So anyway, these are agents, like I said, that are specifically used for kids with specific mutations and with the hope to increase their functional dystrophin. And how are they typically given? They are given as intravenous injections over 35 to 60 minute periods once a week. And the setting, it could be given in the hospital or in the outpatient centers, or sometimes at home. So the recommendation would be patients who are receiving these exon skipping agents are encouraged to continue their medications after discussing with their neurologist about the risks and benefits. When we decide to continue this, it would be preferred to have home infusions than coming into the hospital every week, just to minimize the exposure. Talking about the home infusions, when we have these home infusions or any other sort of home health care visits, make sure we limit the number of visits to a necessary minimum. Also, we make sure that the same provider comes every single time to minimize the exposure, and make sure that those providers who would come to the houses, they have appropriate personal protective equipment like masks, gloves, whatever they need, and they're properly pre-screened for symptoms of COVID-19. Jumping on to heart medications. Some of our Duchenne kids are on medications for their hearts, what we call group of medication called angiotensin converting enzyme inhibitors or angiotensin receptor blockers. These are the first line drugs we typically use for kids with Duchenne either as a prophylaxis or treatment for the heart for the cardiomyopathy due to Duchenne. There were some concerns surrounding the use of these medications to end COVID-19 because there were some concerns that the virus itself has something to do with the angiotensin converting enzyme, which is a co-receptor for virus. And these medications also act through this enzyme, angiotensin converting enzyme. So there was a concern that this may be potential harm. But there are no studies that or scientific evidence that we currently have about use of these medications during COVID-19 is harmful, or use of these medication increase the risk of getting COVID-19. There's no studies that prove that there's no scientific evidence. So the recommendation is to continue to take these medications because we know these medications help the heart. And the risk about COVID-19 is not scientifically proven, or it is uncertain. So we recommend that. And the American Heart Association, American College of Cardiology, and the Heart Failure Society of America, they all issued a joint statement where they also advocated to continue to use these medications. Now, I know there is a lot of talks about hydroxychloroquine. There were some positives, there were some negatives, there's also some concerns pertaining to hydroxychloroquine use. Now, the effect of hydroxychloroquine against COVID-19 is unclear. And we do know there are potentially serious risks to skeletal and cardiac muscles from hydroxychloroquine. There are reports of hydroxychloroquine causing what we call vacuolar myopathy, meaning a muscle damage in few patients. And hydroxychloroquine has also been associated with cardiac arrhythmias, irregular heart rhythm. So the recommendation is hydroxychloroquine is not recommended for patients with DMD. Now, moving on to what happens, or when do you seek attention, and what happens during if you go to a hospital, or if kids get sick with COVID-19 or anything else during this time. Now, when do we need an urgent evaluation? So I say fever more than 103, but any fever, despite use of fever-reducing medications, should be alarming. And if you see any signs of decreased oxygen saturation, for some people they use pulse ox at home, or if you notice anything that's suggesting that oxygen is not enough, difficulty breathing or shortness of breath, increased work of breathing, and decreased urine output. So these are some of the things that would make you worry. And I would strongly recommend to call your neurologist or PCP to discuss these issues and just follow what they advise. Either go to the office for further evaluation, or if needed, you may have to go for emergency room visit. When you do go to the emergency room, or if they have to get hospitalized, make sure we bring our home ventilator support, any sort of equipment that you use at home, including ventilators, masks, cough assist devices, and make sure you know their settings, and also make sure you know the regimen and the plans in hand. With these COVID-19 and lack of resources, there are a lot of places where there are not a ventilator, there are no masks. I mean, the situation is getting better now, but I think still it's important that you carry your own ventilators and other respiratory equipments. I know there's some concern around using cough assist and the spread of COVID-19, but we should continue to safely use the cough assist to support the airway clearance. So this should include using proper protective equipment for the caregivers and also for the patients, for the medical professionals, whoever is using it. But we should continue using the cough assist. This should not be stopped. And of course, to minimize the spread, we should use full face masks with ventilation systems and cupped tracheostomies with closed tubing systems. I know it's complicated. Now, when we go to hospital, or when there is a possibility, or somehow the kid is in the hospital, make sure we at least know about this. The families and advocate for the children, even if the providers are not following. Make sure we advocate for this. Hey, and we need to use the cough assist. We need to use a closed tubing system to decrease the potential spread, and ask for consultation, or ask that you want to talk with a pulmonologist, or like a lung doctor or an anesthesiologist, who could explain to you about this and who can actually advocate for it also. This is something to keep in mind, because not all neurologists and not all primary care providers would know this information, would have this information. Now, if intubation is required, make sure they're not using neuromuscular blocking agents. Again, this comes back to calling or talking to an anesthesiologist or a lung doctor, advocating for that. And the one key thing that you want to remember is succinylcholine. It is one of the older anesthetic, is contraindicated. It's not safe for kids with any sort of neuromuscular problem, especially kids with Duchenne muscular dystrophy. So make sure you tell them, hey, this should not be used. Now, moving on to rehab or physical therapy, speech therapy, occupational therapy, equipment use. So how COVID-19 has impacted this? We know the rehab is a critical part of management of our kids with Duchenne. What are some of the impacts? Now, we do know there's school closures, and a lot of our kids get their therapies through school, but also facilities closure, like outpatient physical therapy facilities are closed because of COVID-19. I know now they're kind of starting to reopen them back again, but this had led to discontinuation of therapies for a lot of our kids. And of course, when we have to talk about orthotists, meaning people who does sort of braces, like AFOs, ankle foot orthosis, and other sort of brace, and equipment specialists, who would deal with wheelchairs, Hoyer lifts, hospital beds. There was limited availability of these personnel because of the COVID-19, and that has impacted a lot. Now, the recommendation pertaining to rehab needs. So clinical urgency of ongoing physical, occupational, and speech and language therapy should be evaluated on a case-by-case basis. And when the decision should be based upon the discussion by the therapist, the physician, and the parents. Pros and cons should be discussed, and decide on what to proceed or how to proceed. Now, home therapy regimens, I think this, our physical therapists discuss this with our parents at every single visit. And I think this is something to keep in mind and try the home therapy regimens. Continue doing them at home, which would include, your stretching exercises. Sometimes continue to do the household work that you were doing before. Don't stop them. Using of splints, appropriate physical activity. So these are some things that we should keep in mind during this time. So with the therapy services and the effect from the continued therapy, we continue to get that effect. Now, you can also always talk to your therapist for creative solutions while you're not able to access any sort of physical or occupational therapy services. And the tele-rehabilitation has been successfully implemented by therapy team members at a lot of places. I have had patients who did telemedicine therapies with our physical therapist here, and also with their local therapist. I don't know how effective it is, but I think it's an option. However, there might be a lot of regulatory requirements from their side that could change from place to place, from state to state, but I think that is an option and that can successfully be implemented. And as far as for orthotists and other equipment specialists, again, it really depends on the need and the urgency of the need. You could do in-person visits, or you could do video appointments, or we could do telephone calls. I have done telephone visits. Our social worker had done telephone visits with some patients. So these are some of the things to keep in mind. These are still possible, and the care should not be discontinued or stopped because of that. Now, another big thing that people talk about in the Duchenne population is the mental health problems, impacts on mental health services due to COVID-19. I know one of our neuropsychologists did a different webinar before. I'm not going to go into details, but touch upon this aspect of it. We do know children with Duchenne have a spectrum of neurobehavioral problems. Not all of them, but it is a spectrum. Having intellectual disability, meaning low IQ, learning problems, autism-like features, attention deficit, ADHD, anxiety, etc. And we do know patients and DMD patients and their family members are at increased risk of depression and anxiety. On top of this COVID-19 pandemic can actually compound the mental health effects because of multiple factors, right? So your routines are interrupted, schools are closed, and there's always this anxiety and fear about what's going to happen because of the COVID-19. Am I going to get sick? Is my kid going to get sick? You cannot go out as normally you would go out. So all of these make the mental health effects even more worse, mental health problems even more worse during this time of COVID-19. And obviously, because of COVID-19, there is only limited availability of these mental health services, meaning mental health providers, counselors, therapists. And with this COVID-19, there's going to be even more limited availability or lack of these services. Again, the key is strongly recommend to continue this at least through telehealth, telephone visits, and telehealth visits. It's important and something to keep in mind. And we have learned a lot from this COVID-19, and the modifications that we have done could be actually be followed as a routine standard of care even without a pandemic, like usage of telehealth, where we cannot really do in-person visits are because of the lack of resources. And one key thing and one important thing is the neuropsychologist or psychologist, and they are rare to find, and not every state and every hospital has a psychologist or neuropsychologist. So telehealth is an option there even without a pandemic. Now we all know how important the research is in our Duchenne world, right? So what are the impacts of COVID-19 on research? So when we talk about research, I'm not going to go into details, but there are these clinical trials, like the treatment trials, where what we call phase 3 or phase 2 or phase 4, phase 2, phase 3 treatment trials, where we're testing out a medication, for example, gene therapy or anything like that. So there are very strict regulations to conduct these trials. The FDA has put out some recommendations and policies to how to conduct research during this COVID-19. And every sponsor like Sarepta or any company, Pfizer, anybody who's working on this clinical trials, they have come up with their own plans. However, so that's the industry sponsored trials, right? And then there are investigator initiated trials, which are smaller, which, that just some investigator, meaning either me or one of the providers, would do some sort of clinical research, not a lot of interventions, like it's not treatment related, but just looking at the medical records, or not a major intervention trial, And then there's also expanded access programs, meaning it's considered as research, but it's a way of getting free medication that's not approved by FDA yet, but we can kids can get that through expanded access programs. I don't think we have a lot of medications available for Duchenne kids currently through expanded access programs. Now, COVID-19 has impacted our industry-sponsored treatment trials a lot, right? There are site closures, there are quarantines, travel limitations. You cannot travel from one place to another place, one state to another state. Then there is interruption in the supply of investigational products. So when we do these clinical trials, we have to stick on to the visits. You have to come. Visit 1 is day 1. You have to come there. Visit 2 is 2 weeks from now. It has to be 2 weeks from now. You cannot change that, and you cannot change the procedures that you do at each visit. So with this COVID-19, it's really hard to conduct these type of clinical trials. And I don't think we have come up with this alternate solution to conduct these type of clinical trials during this pandemic with all the restrictions that we have. Whereas on the other hand, these investigator-initiated research and these the expanded access programs were all going as we would like. We haven't seen a lot of impact on that. So the recommendation, when we talk about these clinical trials, yes, these need to continue. However, we need to keep in mind the participant safety, the family safety, study staff safety, and remote visits, if possible. Replace the in-person visits without compromising the collection of essential safety information that we need to collect. Like I said, we haven't really found an alternate for the clinical trials during this pandemic. There are a lot of institution-specific policies as well. Some institutions would say, hey, you have to stop doing all the clinical trials, or you have to stop recruiting new subjects. So there were a lot of different policies and procedures from different institutions as well. So I think we have kind of come to the end. Like I said, we have learned a lot from this COVID-19 pandemic, which we could keep it in our mind, which could actually be a standard of care practice even without the pandemic in the future. So the key points to keep in mind and to remember: corticosteroids should be continued, and we should not stop this. And stress dosing should be considered in the setting of illness and/or hospitalization. Exon skipping medications can be continued after discussing the risks and benefits with the treating neuromuscular doctor. Your heart medications should be continued. These are usually used for prophylaxis or treatment of cardiomyopathy. Those with chronic respiratory insufficiency, meaning breathing problems, should be treated in collaboration with the pulmonary and/or anesthesiology specialist. Advocate for your kids. When you go to the hospitals, make sure you want to talk to a lung doctor, a pulmonologist. Hydroxychloroquine should not be used in these kids with Duchenne muscular dystrophy. Like I said, standard of care assessments, meaning the routine blood work, the routine tests that we do, can be and should be individualized and adjusted based on patient, caregiver, and the staff safety, with the need for actionable information affecting important management decisions, meaning if we need some information to change anything in the treatment plan, then it's safe to consider those tests with all these safety precautions. And another key thing is strict adherence to the policies that are in place from the state, from the institution, the national policies pertaining to the COVID-19. And always encourage the families and the healthcare providers to work closely with local and institutional authorities to ensure timely and uninterrupted care for patients and children with Duchenne muscular dystrophy. I think that's very important. I know the COVID-19 is presenting a tremendous challenge to our healthcare community and to everybody out there, and we just have to work through it. And like I said, we are learning a lot, and this center of some of the items that we are learning through this pandemic could be a standard of care practice in future. With that, I'm happy to take questions. I think I have several questions came up here. Let me try to. One of the question is, what should I do if my son tests positive for COVID-19? So one, make sure we call our primary care doctor and also the neuromuscular doctor to say, hey, my son had tested positive. Watch for any sort of the signs that we talked about, fever that's not responding to Tylenol, no breathing issues, things like that. If they seem to be stable, it's okay to stay home. But if there are problems that you're noticing in terms of breathing, fever not going away, decreased urine output and things like that, I would talk to the neurologist and the PCP to talk about a plan. Either are you going to go to the emergency room, or are you going to go to the office of those doctors where they can evaluate and see the need. And the next question I have is, do you feel that you can treat patients the same through telehealth? I worry that it won't be the same and will hurt my son. It's an excellent question. I think I didn't talk in detail about, like I said, there are both plus and minus for telehealth. The major disadvantage that I feel about telehealth, number one, is I don't have that personal connection that when we have, I don't get that personal connection to telehealth when we see these patients and the family in person. That there's a personal connection there. You build trust, you build confidence there. So that's missing through telehealth, number one. Number two, not everyone has good internet connection. I'm in Arkansas. There are places in Arkansas where there's no good internet connection. So it's hard for families to get on telehealth. I've had families travel 3-4 miles sitting in the car to actually looking for good Wi-Fi connection. So that's a disadvantage. I do agree when we do telehealth, we cannot do a detailed assessment that we do when they come into the clinic. But one thing we can talk about in the telehealth is, at least if there anything concerned, we can try to see if I need to bring your son to the hospital or to the clinic right now, or is it okay to wait? So that's something that we assess during these telehealth visits. But I do completely agree with you. It does not replace the in-person visit, especially for our population with Duchenne muscular dystrophy. But it is better than nothing. I hope I answered your question. Another question I have here is, has COVID-19 impacted any clinical trials at your hospitals? Yes and no. So, like I said, there were a lot of institution-specific policies and sponsor-specific policies put out for the clinical trials. For example, in our institution, there was a hold to bring in new subjects for clinical trials. There was a hold, if the patients are already on a clinical trial that's ongoing, it's okay to bring them, but we need to get a lot of approvals before we bring them in. The other aspect, the behind the work, like, getting IR, we need to get approvals from the IRB and stuff like that. Those things have not changed. The behind the scene work has not, they have not been impacted, because a lot of people, they were all working remotely, and getting those documents, paperwork kind of stuff was done without any problem. But bringing the patients into the hospital for these clinical trials was a problem, but now people are working through it, and we have policies and procedures in place now, so we could actually bring kids to the hospital for visits. And in the past, there were also problems with getting some tests done, like pulmonary function tests. They were not done in March, April time because of the COVID-19 and the risk of spread. But now we know more about COVID-19, and we had restarted that. I think things are changing, but it has definitely impacted the clinical trials all over the country. Any other things you can recommend to prevent our son from getting COVID-19? Again, I'm going to echo what we talked about before. It's social distancing, social distancing, social distancing, masks. That's the only thing that we could do right now. Avoid a lot of social gatherings, which we already do. I think in our community, we are already extra cautious during the winter months to prevent them from having flu and things like that. I think that's the same way we have to keep in mind. What services and procedures are being done through telehealth? It's a good question. It's a lot of so we are doing a lot of services. We were doing them through telehealth. Our clinic visits, like I said, neurology clinic visit, pulmonology, lung doctor clinic visit, cardiology clinic visits were done through telehealth. Physical therapy, occupational therapy were done through telehealth. We were trying some of the behavioral counseling also through telehealth. Social work consults, nutrition consults, those were done through telehealth. Again, there are pluses and minuses, but these were the services that were done through telehealth. As far as procedures, really, you cannot do any sort of procedures through telehealth. No blood draws, nothing could be done through telehealth. That's obvious, right? I have another question here. I have not taken my son out of the house since COVID has started. I struggle now. Once I let him back out, he will get sick due to the immune system being bad or not being out for so long. Should I be worried? I don't think so. I don't think we should be worried about that. I think we can, I mean, you can kind of go out and take a walk and things like, if he is walking or if he's in a wheelchair, you can go out and drive around, make sure we socially distance and we use masks. But I don't think once you get him back, he's more prone for infections because of his immune system being bad. I don't think that's a concern here. Another question I have is, what procedures are hospitals putting in place to ensure when seeing patients it's germ-free? Excellent question. I know there's a lot of concerns around that, right? So a lot of places are following a lot of different strict precautions. It starts from number of visitors coming in. So of course, all the healthcare workers, we get screened when we come in. They check the temperature. They ask a few questions about COVID-19, your travel, and things like that. And there are restrictions for the healthcare workers right now in terms of travel, going out of state, going there, and things like that. From the families and patients' perspective, whenever we bring in patient to the hospital, to the clinics, we are allowing only one visitor with them, one family member, either mom or dad, and they do the screening procedure, screening questions, check temperature, ask a few questions to you all about your travel and exposure to COVID-19 and things. Once you pass the screening, then you come into the hospital. Then in the seating area in the waiting room, there are restrictions to maintain the social distancing. You always have to have masks, and there's not a lot of waiting time in the waiting room. They are bringing the patients into the room to prevent or to minimize the time you're sitting in the waiting area with exposed to other people. And then they're using special, the Kleenex wipes and the things that they use to clean the hospital bed and the equipments and the floors and everything. So that's been constantly updated based on their efficacy or effectiveness against specific viruses and bacteria and things like that, like germs. So there are a lot of procedures that's being taken and that's being done to make sure we are providing a germ-free environment to our patients and the families in the hospitals. But it's a valid concern. Any other questions? Those are all really great questions.
Thank you, Dr. Panda, for that presentation. That was fantastic, and for answering all the questions. If anyone has any other questions, please feel free just to drop it in the question chat below. But if not, we can always provide you with Dr. Panda's contact information after this that you can directly speak with him to follow up on any more questions you may have.
Sure.
Yeah, if we don't have any more questions, though, we can end the webinar. Dr. Panda, I just want to say thank you so much for, hosting this with Jet Foundation, and we're just so happy to have dedicated people like you in our community. So, thank you, and please stay safe out there, and thank you for everyone who joined the webinar today. It really means a lot to everyone at Jet Foundation for you all joining. Okay.
And thank you. Yeah.
Sorry, Dr. Panda, if you want to say anything?
I know, thank you. Just, if they have any more questions that come, just feel free to share my email with them, and I'm happy to talk to anyone.
Great, thank you. And please feel free to share this with the community. All recordings will go live on our website after. So thank you all again, and please have a wonderful afternoon. Thank you.